headed to Primary Children's Hospital in Salt Lake to hopefully get some answers about my right elbow.
Hopefully we're not here long enough to get a ticket. Where are you feeling?
Right there.
It's a relief to finally have some sort of answers, even though we still don't know what's going on. Good morning. I'm hoping this is going to be a good day for us where we can get some resolution for Brevin on the diagnosis for his elbow. He has an appointment later this afternoon in Salt Lake with a pediatric specialist who specializes in elbows, just elbows, and he's a pediatric orthopedic surgeon. Hopefully he will be able to look at the MRI images and the images from radiology to see if he can give us a little bit more clarity on what is going on and plan a course of action for us. So that's what we're doing today. I'm excited. I'm feeling hopeful and optimistic about this. I think we will get this taken care of for him. In the meantime, we are going to get myself to school. I'm running a little bit late. Ella, this morning, just absolutely refusing to go to school this morning, didn't want to go. So I'm not sure what the underlying fear is or anxiety that she's experiencing, but hopefully I'll keep an eye on her today and see that things are going okay.
I got checked out of school early today. We're headed to Primary Children's Hospital in Salt Lake to hopefully get some answers about my right elbow. This has been bugging me for 2 years.
Yeah, so I guess what we're trying to figure out is, if you don't know, if you haven't heard about Brevin's elbow, hey, shh, quiet, Siri. So we're trying to figure out what's going on with Brevin's elbow. Just in a nutshell, I guess, he cannot straighten his arm all the way out. It gets stuck, and we're trying to figure out if it's some sort of ligament, tendon issue. MRI results indicated that everything looked kind of normal, but obviously it's not normal if you can't straighten your arm. What happened with Brevin's elbow 2 years ago, 8th grade football, got tackled a little funny, or landed on his elbow a little weird, and did you feel something inside?
I felt a tingle from like my wrist all the way up to my shoulder.
Okay.
From landing on my elbow. That's what we think may have caused something weird to happen to where it just like locked up my elbow.
So from that day, your elbow really hasn't been quite normal.
Nope.
So we did go get it checked out shortly after that injury, and they diagnosed it as a small hair fracture on his little radial bone on the inside of the elbow, which was questionable because you could barely see anything on the x-rays. So my guess was, yeah, there might have been a little hairline fracture. There was more to it than that. Something else going on with the soft tissue that may have scarred up weird and now is preventing him from being able to extend it all the way out.
That makes some activities a bit harder for me. Like I can't bowl. Like
bowling is weird.
When we went to
throwing a football, doing push-ups,
can't do push-ups anymore. Throwing any type of ball in general, it doesn't go as far because I can't fully
extend it all the
throw
way.
It without having to use like the rest of my body awkwardly. But yeah, bowling, we learned that when we went bowling as a family, and every time I tried to bowl, I would throw it weird.
Can you say gutter ball?
Gutter ball?
Every time you throw it, you'd pretty much get a gutter ball.
Yeah.
No more football. Football career is over for Brevin. He was going to be a professional NFL punter, but of course you don't need to have a straight elbow if you're just a punter.
Yeah, no, right? He's kidding. I've never had the build for football. I've always been tall,
slender man,
toothpicky. Yep. String bean.
Tall toothpick.
Yep.
That's how I was at the same age.
Yep.
Then you hit your 30s and start putting on weight. Well, muscle comes before, right? You're supposed to put on muscles.
Supposed to put
and
on
maintain
muscle first. Yeah.
You're not supposed to put on weight. Fat weight. Well, hopefully this specialist can take a look at it, figure out what's going on, give us some options and recommendations on what to do, right?
Yep.
Get you taken care of and back to normal, hopefully.
Yeah. It's looking like surgery might be a possibility where they go and just scope out the elbow and clean up whatever junk is just in there. And then I think, just from what I've heard or learned, it was 4 to 6 week recovery time. So
46 weeks?
4 to 6.
Oh. 46 weeks.
46 weeks. That would be terrible.
Almost a whole year of recovery.
Yeah. No. 4 to 6 weeks of recovery.
Alright, well, we finally made it after driving around every level of this parking garage and not even finding a spot except for a little space in the corner. It's not really even a spot, but hopefully we're not here long enough to get a ticket. Well, we'll see.
Yep.
There is X-ray, and don't ask me what looks wrong or what looks normal. The doctor that works with the main specialist just came in. Kind of looked at your elbow a little bit, asked questions, and
Basically what he was saying is when he was squeezing my arm here and like having me drain into as far as I could, he said there was heart stoppage right here. So whatever that means, I don't know.
something's not allowing it to keep going.
But he said there is
Restricting.
a thing that we do know for sure, and it's that I have that weird something sculpty thingy, the big word that he said.
I don't remember.
I can't even
I don't remember what it was.
But basically my shoulder just is like turned in.
Yeah.
Yeah, you are tight as can be. Where are you feeling that?
Right there and like a little bit.
Like right down in
yeah,
there.
in there as well.
Yeah, that is your bicep tendon is rock hard right there.
Maybe that's why I don't have a bicep.
It is so tight.
You've been working your tendon instead of your muscle.
I know, I'm like, I would not beat you in an arm wrestle. Hey, what color material would you like? This blue, if you wanted this one.
Yeah, I think that blue is
This
fine.
one? Okay. Yeah, we'll make some fried chicken when we're done with your brace. Once it's kind of softened up, I'll just kind of stretch you and mold it. Dr. Hutchinson probably showed you the x-ray.
Yeah.
The joint doesn't look
looked
normal.
pretty normal.
Yeah. Well, on your other side, it
It looked
did.
completely normal.
Yeah, but you could tell there's just
Something
something
in
not
there.
quite right. Yeah. All right, I think this is ready. So I'm just gonna cool it down and it doesn't need to be like completely normal looking. There's tons of guys that have weird looking elbows. Like I tell you what, when I work with pitchers.
Oh yeah.
Sorry, is that too hot?
No, that's warm.
Yeah, you let me know if it's too hot.
Okay.
When I work with pitchers, man, those guys mess up their elbows so bad. I'm literally gonna pull on you a little bit. You okay right there?
Yeah,
Too much? You can
I
tell
can
me
handle that, yeah.
If it's too much, let me know. I would want you to feel more stretchy pain than sharp pain. So now I just need this to cool down. Okay, my man, that is it right there. You saw that using heat is how I mold this. So if you leave this in your car, what do you think's gonna happen
It's
to it?
not gonna work, it's gonna like mold.
Yeah.
It'll start deforming.
It'll totally fall apart. Though the best way to clean it, if you're having any problems, is with like a Clorox wipe. lukewarm water and dish soap works great.
What was the name again of this type of therapy, the sling?
Static progressive splinting.
Splinting.
Yeah.
Let's see what it looks like.
It just looks like that. So you can't tell how it's been.
No, let me get a further away.
Okay.
We've got a static
static splint thing.
static splint, static progressive.
Yeah, there you go.
Splint.
Like, just right now, I can already feel us stretching, so.
Well, that's because you got a splint on it.
Well, you know,
Right?
no, I can already feel it start to work.
Right.
Is what I meant.
Okay. Quick summary of the visit. We visited with, 2 doctors and a therapist.
Yeah.
And they're going to continue trying to figure out what is going on. They're going to look at the MRI more carefully. They're going to look at x-rays that they did in addition to the x-rays we already had. And in the meantime, they suggested that we start this static progressive therapy, static progressive casting, so they can try to get a little bit better number on the degree of extension. If numbers improve, then that'll be the goal, is to just keep doing that. If they don't improve after a while, surgery might be...
Oh, the casting first. Sorry, casting first.
Cast.
And then...
Surgery is the last resort. Surgery would only be if they go in and figure out exactly why he is not able to extend. So we're supposed to hear back from them on if that is even recommended. In the meantime, Brevin gets to sleep with this bad boy every night.
Well, it turned out to be a pretty good day, just like I'd hoped. We found out a little bit of information for Brevin. He was starting to wear that brace that the physical therapist provided for him, and already we've seen a measurable difference, not a huge difference, but at least enough that it's visible. So that's encouraging, and I think it's a relief to finally have some sort of answers, even though we still don't know what's going on. Even though we don't have the answers. At least we feel like they're more educated non-guesses. I don't know, what do you think, babe? And just a follow-up, I mentioned earlier that Ella had kind of a rough morning this morning. Getting her out of bed was a little challenging, and she was crying and saying she didn't want to go to school today. She just didn't want to be there. And I even ended up walking with her to her classroom and let her teacher know that she kind of had a rough start in the morning. I wasn't sure what was going on. But as it turns out, her teacher shot me a quick message within 10 minutes that she was doing just fine. And I think a large part of maybe what was going on, well, first of all, I think we can safely determine that Ella is not a morning person. That's okay. She's probably still very used to the schedule of the summer, which allows her to stay in her pajamas all day long and watch videos and eat popcorn in her bed. I think this transition into a more structured school day has been a little bit challenging. Also, last night there was a really awesome thunderstorm that rolled through, and it had quite a lightning show for us, and so our kids, we let them stay up a little bit later to watch it. I think that may have had something to do with it. But she came home and was just fine and said that it was a good day and she had a good time. So now I feel a little bit like a mother hen. We're gathering up all of our chicks tonight from soccer practice and football practice, and we're gonna take them home, feed them, and put those little babies to bed. And have a good day tomorrow. We hope you have a wonderful day as well.